And we're back with Dr. David Livingston, who's a chiropractic physician. Thanks for being with me, Doctor.
My pleasure, Eric.
So your office is Family Wellness Center in Delray. Tell us a little bit about your practice.
Well, I've been practicing for 15 years in Delray Beach, and we see patients anywhere from 5 years old up to 102. Low back pain, neck pain, all sorts of traumas.
Well, if someone told me that they had neck or back pain, would it be necessary for them to undergo surgery or take drugs?
It's interesting you ask that, because most of our patients have already gone and ran the gamut. They've been to the doctors, they've taken the drugs, and they've had the surgery, or they're scared of taking the surgery or going through it. And no, it's not necessary. In fact, I remember a patient of mine came to me, and she told me a story once of a doctor who was seeing a woman, and she had gotten all the cortisone shots, all the drugs, all the surgeries, and all these things, and all it was a pain in her foot. And nobody ever looked in the foot, in the shoe. And there was a pebble in her shoe. So they took the pebble out, and that's what
she feels better.
she felt great. And it
Princess
cost her,
and
I
the
think,
Pea.
$30. Exactly, it cost $30. And
well, what's the difference between traditional traction that some doctors have utilized for neck and back pain and your more advanced SpineMED computerized spinal decompression program?
That's a good question. I relate it to like a 1975 Cadillac. If you remember, they were really cushy and they absorbed the shock, the road, and with their big shocks, but they really didn't do a great job at doing it. But then you take a 2005 Cadillac, and boy, it has infrared sensors, and it senses the temperature, and it knows how many people are in the car, and how much luggage, and how many trucks are on the road. You know, the traction did its job back then really well, but the spinal decompression really pinpoints exactly where the problem is, decompresses it, takes the pebble out of the shoe better than the traction did. Good question.
What makes your SpineMED program so effective with neck and lower back pain, as well as sciatica caused by herniated discs, compared to the other spinal decompression programs advertised in the area?
Good question. To answer that question, we need to do a tiny bit of anatomy lesson. A disc is like a soft jelly donut that's sitting between two hard vertebrae. And as we get older, or as we have traumas, even in our young ages, I mean, kids fall thousands of times before they're 15, that jelly donut starts to take up more space around it, irritating nerves, causing sciatic and pain like that. So what my machine does, safer than the other ones and more effectively than the others, is safely decompresses that disc and reestablishes it with more fluid in it. Whereas the other machines, they pull real hard because the sensors are much farther away. So it's kind of like a Ferrari versus the best Chevy there is.
Is the SpineMED system safe, and what are the risks to the patient?
There really is no risk as long as the protocols are followed properly. We do not see patients with osteoporosis of a negative, what we call a T-score of 2.5. And we don't see patients with some other contraindications as well. So as long as those protocols are followed, there is no side effect or risk.
Why is this a great option for athletes and sports enthusiasts?
Well, athletes are like that Ferrari I was telling you about. They're driven hard, and they got a lot of moving parts. And the therapy program that we have addresses that with athletes. It's a lot of microtraumas going on every day, especially with golfers in South Florida. They're twisting and they're turning and they're angry and they're throwing their clubs. But what we do is we address those issues and get all those moving parts moving again the way they're supposed to, and this machine does that perfectly.
Well, how do people reach you and get in touch with you?
Well, my website is www.delraybeachchiropractor.com, and they can get in touch with me that way.
And the phone number?
561-498-1098.
Great. A little bit past the 1094 number.
A little bit, yeah. Just
thanks for being with me, Doc.
Thank you very much.
Good luck to you.
Nice
Appreciate
to see you.
it.
Thanks a lot.
And we'll be right back.